Good morning, Carver. It's an emergency meeting of the Board of Health. It's Monday, March 23rd, 8 o'clock in the morning. And I'll start with an important order that we issued over the weekend. Immediate order of closure from the Board of Health, effective March 24th at 12:01 a.m. The Town of Carver Board of Health hereby orders the immediate closure of all non-medical personal and care facilities. The orders come due to the inability of those services to maintain appropriate social distancing of the 6 feet between operator and client. This includes, but is not limited to, hair and nail salons, barber shops, spas, bodywork facilities, body art facilities, and cosmetic facilities. Physical therapy facilities and other medical licensed facilities may remain open. This emergency order shall remain in effect until April 7th, at which time it will be subject to further review or notices given pursuant to Board of Health's judgment that the public health emergency no longer exists. We appreciate your understanding and support. Arthur Borden, the chairman, Eric Mueller, member, Barry Callis, member. We have several things we want to discuss today. I guess the first would be just an update from our agent on how we get notice as to cases in town and in the follow-up for them. Kevin's been in contact with the appropriate people, and if you'd fill us in, Kevin, I'd appreciate it.
Sure. We have set up on our website links to the DPH website. It is something that's updated on a daily basis. It's very comprehensive, it's very informational, and basically it'll answer just about any question that you might have regarding home care during self-quarantine. It lists the updated number of cases statewide, breaks that down by county. So it's a link, so it's automatically updated every day, so that if any changes are occurring, it's going to be in real time and it's going to be there. So I encourage you to go to the Town of Carver website, click on to the Board of Health page, look for the coronavirus link. That'll open up the main DPH page, and then you can navigate through that page to get answers to just about any question you may have. In addition to that, as most people know, the town hall is closed to the public. We are still partially staffed. Some people are working from home, some people are here. That is something that we were also going to be discussing today. There were a number of signs that were put up throughout the town hall. It was really more for the public. Since they're not here, they'll remain, but it's just a matter of paying attention to what is being suggested, pay attention to the guidance, and we'll get through it. While I have the mic, I might as well point out that over the weekend I was able to determine a means by which the Board of Health can be notified of cases as they come up in the town. That information is not to be disseminated to anyone other than the police, fire, and EMS. The particular program that I was able to make a contact with is the Massachusetts Virtual Epidemiological Network. MAVEN is the acronym for that, and it is a new web-based disease surveillance and case management system that enables state and local health departments to capture and transfer public health laboratory, and clinical data. That's very important because our first responders need to know if they're going into a home where someone has been tested positive. The information that I receive is an address only, and that's what's presented to the public safety officials. So far, there have been 2 cases reported in Carver, and that's what I have right now.
And once it's reported, I think through the Visiting Nurses Association to you,
Yes.
and what is the procedure? From what I've seen, I think they do the follow-up interview with the people that.
Yes, they do. When they receive the positive identification, or positive test, I should say, they again notify the Board of Health through my email. They then have a case nurse that follows up with each individual to try to determine people they've been in contact with, and then they reach out to those people, and they basically will follow the case to see if any of the people that they got into contact with are being infected as well. So there is follow-up to that. They also presented me this morning with a request. That is, there are 2 methods for terminating self-quarantine. And one is a test-based strategy, which is largely unchanged, that takes 2 negative swabs at least 24 hours apart, resolution of fever without the use of fever-reducing medications, and improvements in respiratory symptoms. The other method is a non-test strategy. It is new, and it can be applied to anyone who does not work in healthcare, who is hospitalized, or is considered to be immune compromised. So basically, the process for that type of strategy would be the symptomatic person with COVID-19 who are in home isolation may discontinue home isolation after the following conditions apply. At least 3 days have passed since recovery, defined as resolution of fever without the use of fever-reducing medications, and improvements in respiratory symptoms, such as your cough, shortness of breath. And lastly, at least 7 days have passed since symptoms first appeared, and the onset of the symptoms would be considered day 0. So they are asking the board what strategy that they would want to impose to determining whether or not people can come out of isolation. From what I've heard, it's not real easy to get a test. I was told of a story where a gentleman had symptoms, went to, I believe, I want to say it's South Shore Hospital, but I can't be 100% sure. But they do have a tent set up outside, and they did not allow him to be tested until his symptoms were more prevalent. So that being said, I think that if we do the non-test strategy, the only problem that I see with that is we're relying upon people to make that determination. It's not being, it's in other words, with the test strategy, you know full well that the person is no longer symptomatic and no longer infected. But then it's an issue of the logistics. How do you get tested? So she's asking for direction from the board on that one.
So the availability of the test is very limited right now.
Seems to be, yes.
Very limited. And unless that changes, my inclination would be the second option.
And could I just ask on that, even if the tests were available, would it be the visiting nurses that would go out and do the test? Because we don't, I mean, Kevin doesn't have the staff to do that, so even with option one, it'd have to be a third party that would be doing it, correct?
I don't know the answer to that, but I will reach out to the Visiting Nurses Association after this meeting and, find out exactly how that test would be done. If it could be done through them and it could be done relatively quickly, then that would be the obvious choice, I think.
Yeah. But like Barry said, the tests aren't available now, so they can't do it now. And I'm just thinking in the future, that's why I was asking the question.
Yeah, I mean, unless that changed, unless
Right.
tests were more widely available,
And I think we'll see that over the next week.
we likely will, yeah.
Yeah.
They seem to have ramped up.
Yeah.
So let me find out. I would certainly like to be able to do the test strategy because then there are no questions as to who is cured and who isn't. So I will find out, and the board can make a final decision after I find that out for you.
But again, Kevin, I think it's critically important we find out who is going to be doing the test, because the town does not have the capability to do that. And, I think people need to recognize that, our public safety folks is, limited to a few handfuls. And they're here to provide 24/7 coverage, and going out and giving swabs and tests is not something that we have the manpower to do at this particular point. Nor are they properly trained for that, as far as I know.
Best case scenario would be that the visiting nurses has the staff to do that.
Correct. Can I also just make one comment, too, on the two cases we have in town, just so everybody knows, because there may be people in the public that want to know who they are, and I think, Mr. Chairman, you acknowledge that, is that they're still protected under all federal and state HIPAA regulations. So we cannot release the name or address to the general public. That still follows those rules. But as Kevin said, is that public safety has the need to know, and that's the only exception that is currently available right now. So I'm sure you're going to find on Facebook, people are going to want to know who it is, and they're probably going to try to assume who it is, and we should discourage that, because that creates, that infringes upon people's rights that they have under the current laws we have right now.
Well, even as Kevin said, while he's getting from the VNA is an address, so, as I've been saying, we don't know who, we have no idea of knowing where they've been or who they've been in contact with. Nobody's really privy to that information, and now we at least know the visiting nurses are gonna be following up on that, and, that's a bit of a relief, but, it's really not anything that we can do, so. All right. Anything else?
I spoke with, I spoke with a number of employees within town hall over the weekend, had a number of calls. They are still understand that we've done everything that we can to make the building safe in terms of sterilizing and disinfecting. However, they're anxious, for lack of saying anything in any other way. They feel as if they are, in some instances, too close at times, and so I was thinking that, is there a way that we can structure the amount of people that are in an office at a time? So if we have a staff of 4 in an office, can we stagger those times that they may be in so that we cut that number in half? Thereby, you create the distancing, and it just makes it just. I think it'll make a difference. It's just a thought. I know that there are other towns that have done that. Some towns have completely shut down, public, including employees. No one is in the town halls, and I think Abington, Middleborough, Wareham, and I can't recall the last one. But I don't think that that's necessary, personally. But I think if we can limit the number of people that are within a particular office, it's just another step toward minimizing any exposure among the employees. And it still allows the town to do the minimal functions that are required. And I think it's logistically, it's something that can be done fairly easily. Just a thought.
Who's going to follow up on that? Is you or working with Michael or?
I think it should be a collaborative effort between the Board of Health and town manager.
Department heads?
So let me suggest this, is when we met last week, we had originally planned on having Town Hall open Monday and Tuesday, and then we were going to have people come on Tuesday outside and wait to come in. And after we met with staff and everything, and given what's happening, we decided that we weren't going to open to the public at all. So that changed since last meeting. Again, this is an evolving process we're in. We have kept it down to 2 days a week for Town Hall, and we were focused on Monday and Tuesday. And certainly, it's up to the Board of Health, and I see no reason with this is that if as Kevin said, you had 4 people in the department, and you wanted to try, and if we're going to keep Town Hall open 2 days with staff coming in, that you try to stagger those 2 days with 2 and versus all 4 on the 2 days. I see no issue with that. I think that that's good. I think if that's something the Board of Health wants us to pursue, we can do that. Again, keep in mind, we are practicing the 6-foot rule now. We're practicing all the social distancing that we're required to do. But I see no issue and would encourage the Board of Health, if you want us to enhance that, let us know, and we'll do it.
Personally, I think we should. I think that, we need to have some presence in town here for, so the town stays running. The ability for people to be able to call for an answer. I think it's important that we have somebody in the departments, and if we can split it up, 2 in the morning, 2 in the afternoon, or whatever, to make the numbers work, I think we need to do that.
Well, I think what we'll try to do is we'll try to keep people in Town Hall Monday through Thursday then, and we'll just try to, instead of where we had groups everybody coming in on Monday and Tuesday, we'll have a group come in on Monday, Tuesday, we'll have a group come in on Wednesday, Thursday. And then, plan to be here the whole day, obviously with limited staff to keep things going.
Right.
You're absolutely right, we have to keep the essential functions of the town operating. Again, our primary objective is to the health and safety of our employees and to the public. So if that's the priority number 1, priority number 2 becomes our public safety folks, police, fire, EMS, and DPW. And then, so that's the priority 2, but in order to have priority 2 going, you have to have priority 3, which is paying the bills, paying the payroll, buying the supplies that our public safety needs, and making sure that money's collected and properly processed, plus at the same time doing inspections around the town in a safe, orderly way. So we still need to keep the functions of the town going. I'm not sure how some of these other towns are doing it. I think that, they may have decided they're going to try it for a week or 2, but they're going to have to come back. And they just may be hoping that it was going to be over in 2 weeks. We're not anticipating that. When we've had our department head meetings, is that we're planning to keep this operation going through the end of April. If for some reason this gets better sooner, great. But we're being more cautious and planning it out for the next 6 weeks than we are trying to do a 1 or 2 week type thing, because we think it's going to last longer than 1 or 2 weeks. We hope it doesn't last 6 weeks, but we're planning through the end of April. So I guess, with the board's, directive, that we'll stagger our Monday, Tuesday through Monday, Tuesday, and then Wednesday, Thursday, and figure out how the department heads want to split their staff up accordingly.
Good with that, Barry?
I'm good.
Okay,
Yeah.
Eric?
Yeah.
Okay.
Wait a minute, boss has a question.
Uh-oh.
Yes, boss. Well, that was primarily, I talked to Dave about that too, just for more clarity. He was more focused on the public coming in. So if we keep it just staff, we're okay. And I guess that's the other question, let me just go on that, is that, so we do have a limited amount of supplies in the town. We're trying to order more supplies. If we had the public coming in the building, we'd run out right away, okay? So we've stopped that, so we're not gonna run out right away. But we are gonna run out until we can resupply those. What Elaine's talking about is limiting the amount of people that come in and out of town hall. Again, right now, it's not open to the public. Our next step is, when it comes to boards and committee members, is that, and this would be helpful for you guys to provide a directive on as well, is that I know we have a meeting tomorrow morning at 9:30, but after that, we have nothing scheduled, I think, until April 14th or 15th. And at that point, we're even looking at remote participation meetings. You're seeing a lot of the Zoom meetings take place that are all being done over the internet. You know, just like, as Elaine said, it's easier for staff to know who's here and how to keep things clean. If we have random people coming in, obviously the public's not allowed. It may be beneficial to limit the amount of board and committee members that come into town hall unless absolutely necessary or for a scheduled meeting, with the preference that those meetings be done on Skype where possible. Again, we're just looking at, as Elaine said, trying to maintain things to the best that we can. So I'm curious what your thoughts would be on something like that.
Yeah, I mean, that works. Would you be able to supply a list of each committee and then all the members with contact information? So if somebody from another board needs, they can reach out.
Okay. So Elaine, we have a list of all board and committee members we can kind of send to all board and committee members. We have a list of all board and committee members' email addresses? Okay. All right, why don't we do this? If that's the direction the board wants to go, maybe we can have Kevin, work with us and under Kevin's signature, send something out kind of describing how we want to go forward with board and committee members. He can forward it out to all the board and committee members. All their names and emails will be on there, so you guys can reach out to those individually. Obviously, if you need anything, email's the best source of communication right now, and, we will get that available as soon as possible. Since I have the mic for a second, just two other quick points. One is that we are releasing a daily newsletter that Elaine is overseeing. We talked about that last week. In that, there's also a hotline number for anybody having a Town of Carver issue. To date, I don't think we've had anybody call yet on that, but that's okay. It's available. Yeah. And then anything as it relates to COVID-19, we're not the experts. We're having everybody call 211 on that to ask that. Yep. And I would like the board's one more thought that I want to run by you, and just to get your concurrence on this or directive, is that, as you know, we're a small town. And last time I checked, I don't have any scientists or paid medical professionals on staff. I don't have any nurses, I don't have any doctors, I don't have any scientists. Okay, so since we don't have those staff, we have professional public safety folks, but I don't have scientists, doctors, nurses, is that we have to rely on the state and the CDC for all our information, and as you are too. And I just want to make sure everybody's clear, that's who we're relying on as our experts, is that we're not in a position, at least I don't feel staff is in a position to second guess what DPH or CDC puts out there. We have to kind of follow what's there. And I know that some people have been questioning those documents, and I'm just not in a position to do that. I don't think Kevin is. I don't think any of my staff is. So I'd like some direction from you guys as our health board as to who should we follow.
I think I've tried to make that clear, and at least in the two orders that we've issued to date, is that we're getting guidance directly from DPH, and because they're the people that know. We, as you say, you don't know, we don't know, and we're just relying on the best information that we think is coming out of the state. Some people don't agree with the state, but there's no other expert at this point that I can see that we can go to. There seem to be several experts around town, but, that they're obviously not happy about following direction. They have their own direction, and, but no, everything, all the conversations we've had, this is what DPH is saying, and we're in agreement with it. We don't know what else to do at this point.
I'd just like to add one thing as it relates to the state and their response. As I said over the weekend, I was trying to find out how I could become a member of Maven. And I won't repeat that name because it's a long name. But anyway, you have to become registered. You have to do a lot of different things. You have to be trained in order to use it efficiently. So I listened in on a 1-hour presentation by DPH and it was specifically dedicated to Maven. And I had more questions after than I had before. But that being said, I emailed Ron O'Connor, who is I don't know his title, but he's an official within DPH, and his name is on all of the emails that come through from DPH to the Board of Health. So I emailed a number of questions to him, and within 2 hours, I had all those questions answered. So they're very responsive. Their guidance is it's invaluable. So there are ways of getting answers to questions, and I would rely upon those people over anybody else. They're at the forefront of it all. And DPH is getting direction from CDC. So, and I find that all of these agencies are doing a hell of a job working together. For instance, I sent out a mass email to all the Board of Health agents within Region 5. And I had a couple of questions. Basically, what are you guys doing in this case? What are you doing in this case? And the response is incredible. I mean, out of 30 some odd communities, I'm getting people from 15, 20 communities responding. So that, again, we're all working together, and again, just to reinforce the idea that I wouldn't go to anybody else but DPH and CDC and my fellow Board of Health agents out there.
I just wanted to add to these two comments. The materials that guide our response are informed by the medical director of the Infectious Disease Bureau, Dr. Catherine Brown. So everything that we get from DPH is informed and directed by her. She's the medical director, and I would agree, Ron O'Connor, he's the director of Office of Local and Regional Public Health. Great resource for us. And just to echo, peers, we're all in this together, and anytime we need something, I'm glad that you reached out to peers who can reconcile some of the answers. And I know that there are folks available to walk us through Maven if we need it.
Yep.
I'd just like to echo the availability of DPH. I had the opportunity to speak to Dr. Brown last summer when we were dealing with the other issue. She was most available, more than willing to talk and explain what was going on. Had a very hands-on understanding of what we were dealing with here in Carver, and encouraged me not to hesitate to call her at any time. So it's nice, it's comforting to know that those types of people are readily available to us.
I know she was invaluable to us last summer
Yeah.
during Triple E.
Yeah, that's when I spoke to her. She was great, yeah. Okay. Okay, moving along, we have some other things to discuss. We've had concerns about restaurants with takeout and not just curbside pickup. I guess we need a little discussion on how the board feels about that, if we can eliminate the potential of takeout, going into restaurants to grab your stuff and come back out. Most cases, it's at least one door, sometimes two doors in, a counter, two doors back out. What, I guess, what are your thoughts?
Yeah, I mean, a majority of the business, they're all different in town. They're taking the biggest impact. I mean, if we can encourage them, if they have the opportunity to just allow curbside pickup, rather than having patrons come into the restaurant itself, there's a number of touches going on. I mean, 20, 30 customers come in, touching those doors, touching the counters. I mean, it's more interaction and germ spreading. And this is a highly contagious issue. So if customers in town or restaurants in town can offer that just curbside, you know, they pull up, they can make a phone call, they come out with their food, they can pay, less apt to carry germs in. You know, I know there's situations in town that it doesn't allow that, but if they could do that, I highly encourage it.
I would agree with that, along with setting up a system to identify what kind of vehicle someone is in and maybe going to the vehicle, keeping the distance.
Right.
But that's another option if they wanted a further limit, if they needed more space.
Yeah. Maybe we could, if they had any questions, we could have them reach out.
Yeah.
You know, what we're looking for,
Right.
for help from the community
Yeah.
on that. We don't want to see them close. We want to see them continue to, you know, through these times,
Right.
move forward. So if they can limit the amount of touches, that'd be great.
So if I understand, then you would be looking for this to be a means of encouraging them to do that, but
Yeah.
not a mandate,
Right,
Right.
yeah. 'Cause
if
that-
they have
as
the
is-
capability to do that.
Yeah, there's too many different facilities in town. Several of them can accommodate that. Unfortunately, some of them can't. But if we can encourage it where we can, then that'd be the thing to do.
Could I just suggest, just listening to what you're saying, is obviously if you're a Dunkin' Donuts and you got a drive-up window, well, that's easy. But, you know, without naming another restaurant in town, but if it's predominantly sit-down and they don't have a drive-up window, then it creates a little bit of a challenge. Maybe what you want to have them do is to submit just a letter to Kevin explaining how they intend to keep the area where they're providing the takeout sanitary, and then have him review that and figure out what the best scenario is for each business, because each one of them is going to be different.
Right.
And if they're proactively providing how they're going to, because your question right now, as I'm serious, how are they doing it if I got 30 people coming in and out of two doors? Your question is how. You don't know, yours says how. And because I don't know how they're doing it, I'd like them to do it safer. So maybe you're asking them, okay, put a little plan together as to how you're going to do it to make it safe, so Kevin can review and then he can approve on an individual basis, again, so that each business is different that's there. But at least then you'll know how,
Right.
because he'll have a plan and then they have to follow the plan.
Right.
And Kevin, that could just be in an email. It doesn't have to be anything elaborate, just, you know, what their
Right.
protocol
Right.
is.
Yeah. Uh-huh. Well, what I would need to do is I would need to, in essence, visit each one of these establishments and just let them know. Because there's no assurance that if we just put it out there as a public statement that they see it
Yeah.
and respond to it. So, I mean, it's a drive-through town. I mean, start at one end of the town, go through it. I mean, there aren't that many places
Right.
that would be subjected to this, this type of encouragement. So, I plan
Well, you
on-
could do that, or you could have your staff down there send out an email or a letter to them first.
Well, that's true.
And then
We have
after
all-
they submit something to you, then you can go just
Yeah,
meet with them to make
Right.
sure it's fine. But,
yeah.
you know, to have you drive to each one of these businesses, we've got the staff here for a couple of days.
Yeah.
Let's have them at least reach out for you, but you've got to tell them what you want.
Yeah, no, that's true. They do have a list of all the food permits and contact information, so.
Right.
Yep, can do that.
You're busy, I know that.
Do we want to address anything on the schools with I know we're going to talk with the highway department about trying to get those locked up.
There has been some concerns. The previous order we issued about closing the playgrounds in town. We're still working on getting signage out and getting some precautions for people. I've reached out to the school committee and the schools to make sure that they can at least secure all of the gates at the facilities. Question becomes, like the playground at the elementary school, there's no gating around it to keep people out of it. And I've seen concerns that people have made that, well, golly gee, we saw people at the playground over the weekend. I responded to one of them with the idea that, okay, you're aware of our closure. You could politely inform these people that may not have known that, instead of just, running to social media and putting up a post. I have reached out to Chief Dupley. He was going to put a new post out today from the police department, reiterating our ban and with the idea that they were prepared to enforce it if they see people on these playgrounds. Unfortunately, it's the same problem we had back in the fall when we closed the playgrounds for the Triple E issue. Even with signage, we were finding people on the playgrounds after dusk. I approached one family. Oh, well, we saw the sign, but, we figured we'd play, but we're getting ready to leave now because, golly gee, the mosquitoes are coming out. But that was the whole purpose of our signage and closing the facilities down, was to keep people away. It's the same with the playgrounds now. And it's, again, it goes somewhat to the social distancing also. It's to limit the number of people in these facilities, but as Eric said, everything that's touched now, and we've seen information where facilities like playgrounds and the materials that they're made out of, this virus lives for a considerable amount of time. And it only takes a touch to your face and boom, you got a problem. So I would encourage people that are aware of our ban, if they see people on the playgrounds, go up and just have a polite word with them. And we're working on how we can, close off the basketball courts. But it takes time. And unfortunately, poor Kevin is just, he's got a whole bunch of other stuff to deal with. So, I would encourage people to, help us out a little bit. If you're aware of it, keep your kids away from the playgrounds. If you see kids out there, just make a nice polite comment to them that, sorry, but, they closed these playgrounds down a week ago. Anything else?
Do we want to discuss the workout facilities? I know that's become an issue and discussed. Fitness gyms.
Have you got, we talked about whether you had any directive on,
There is no directive from, from the governor or CDC, DPH. I do know that, all the Ys in the area are closed. Most of the dance studios are closing. I would encourage it. People can find other ways to exercise for a couple of weeks if if the board wants to make that requirement to shut down until I think the magic date is April 7th.
Right.
There's only a couple of facilities in town. We could get word to them. I just would need to have your direction to make that make that happen.
I am in favor of that.
Yes. And I know that the information might be a little skewed because the governor has suggested 25 people or less, but DPH is 10.
And
right?
So, less people the better. We know that. Social distancing. I know everybody's in there and working out, and there's a lot of touch,
Right.
sweat, everything else. So,
I don't think 2 weeks is unreasonable to,
no.
like we're doing with our other orders, to 2 weeks and then we'll review it. Perhaps by then the state will have issued some guidance. So,
And that was, I think, the initial thought is that period of time, the 3 weeks with the schools, children, you know, this virus develops, they said, between 1 and 7 days. Could be 2 weeks before you're completely resolved of it. And that's what they're thinking, that if a lot of people had it and they're self-quarantined, not interacting with others, if they get it, it's going to go through and less apt to spread. That's why they want the distancing. And I think this will help with large grouping of people or areas where a lot of items are touched, spreading.
I believe we've got two of those gyms in town. Do you want me to inquire as to what they're currently doing? Or, I mean, if they're limiting it to 10 people at a time and they're got a disinfecting program going on, if they've got protocol as to, you know, if you use a particular station, what do you do? You know, are they being required to be? I'm just asking. Do we want to find out what they're doing, if they're doing anything at all, or do we just want to simply say, you know, shut down till the 7th?
I'm in favor of, this is a short-term act for a longer-term gain. And I know that it's inconvenient, but the value of the short-term gain, I think, outweighs the many risks that potentially could take place.
Yeah, I just wanted clarification, that's all. All right.
so I think we're in agreement for a 2-week shutdown for whatever fitness gyms are still open. And we'll go with that magic date of,
April
the
7th.
state has said April 7th.
And you would want that effective tomorrow?
Yes. That gives them a little bit of notice. Not much, but still it needs to happen.
Right.
Okay.
Anything else? We covered everything we need to today?
I think so, yes.
I think, Barry, we got it under control?
Yeah, I just, USA Today, I believe, has a note on their door that they're closed already.
Yes, they closed
Okay.
about a week ago, or
Yeah.
actually maybe a little longer.
Okay,
Yeah.
All right.
sorry, I was just looking at a photo
Okay.
of the sign.
Good.
All right.
Okay.
Yep, and just encourage the residents to reach out if they have any questions. I mean, communication is key,
Right.
especially these trying times.
Yeah.
So,
And we are making an effort now to have town hall staffed minimally for 4 days a week now. I encourage people to visit the town webpage daily. The update is in the right-hand corner. You can't miss it. Click on the link. Elaine has been diligent about updating it every day as to what's going on. That's the best place to get your local town information right now. And while you're on the town page, click over to the Board of Health page and see if there's any further information from us.
Also, I plan to be in the town hall most days. I do check my emails constantly. I do call in and check my phone messages as well. So I just encourage you, if you have questions or need direction, by all means, give me a call or email me.
yes.
I do have one comment for us, given that this is a changing situation, and that there may be questions that we have not been able to anticipate always. Do we want to have a frequency of meeting a little bit more regularly, just to respond to resident needs or needs of businesses or other needs that we might? Do we need to meet more frequently just during a short period of time to make sure that we have a chance to communicate? So that's I'm proposing that we do that weekly,
Well,
I'm fine with that.
Sure.
just so that we can share information, respond to things that come up, be available to residents if we need to be,
Right. No, great idea.
Yep.
for some period of time. Maybe we use that April 7th date, but just want to build something in for us to bring things to this space.
That's fine.
I agree.
I guess we can work out the logistics,
Right.
but just to keep our focus on now and respond to what might come up.
We may be able to set that up remotely, too.
Yeah.
I'll have to have somebody teach me.
We're all getting crash courses in WebEx and Zoom and other
Yeah. Yep.
platforms.
Yeah.
Well, even if we have to meet here first thing some morning, that's, whatever the availability is, so.
Just in a couple of days over the weekend, we've had a lot to talk about that's filled almost an hour of time. So.
Right,
Exactly.
right.
Yep.
Agreed?
Okay. Anything else?
Nope, good.
Entertain a
Okay.
motion to adjourn?
Motion seconded.
All those in favor?
Aye.
Aye.
Thank you.
Yeah.
Thank you, Carver.
Thank you.
Thank you.